Our organization has a phenomenal R&D capability, which is augmented by the great knowledge that our over 125,000 colleagues have across the globe. As we continue to navigate a post-pandemic world, we will look to see how we can address public health challenges beyond just COVID.
Opportunity within Thermo Fisher is there's a problem of plenty, and we are an organization that has many different divisions and companies.
So my day-to-day activities as head of commercial operations for the Global Health Equity business really focused on aligning our efforts against our plan, our strategic priorities in terms of delivering upon the mission of supporting the needs of countries, working with global funders to align with their strategy for these regions and supporting the health systems and the public health initiatives in these regions, making sure that our public health developers have what they need to be successful. The tools they need to communicate, the diagnostic solutions and other solutions that Thermo Fisher offers.
So within Global Health Equity, I work in the central commercial team, and within that there's two main aspects to my role. The first is as an account manager, where I manage the partnership with our key global health customers, so organisations such as the World Bank or PFSCM, who are a pooled procurement agency who work on behalf of the Global Fund. In addition to that, I also work on commercial enablement. So setting up our business, setting up Thermo Fisher and the Global Health Equity business, really to serve our customers in this area much better and to put in place the systems and processes that are needed for us to bring an efficient and quality service to those customers. So on a daily basis, I'm working with our customers to agree contracts in order to get our products onto their procurement platforms and accessible to customers, people like Ministry of Health in low and middle income countries, so that they can buy our products at the price that we offer, our Global Health Equity access pricing.
In my role, I specifically look at what products and portfolios we have available in our portfolios today that we can actively commercialize, whilst being cognizant of what portfolios we will continue to innovate and develop in the future to address future public health burdens across the globe. By harnessing the strength and muscle of what we're able to do as an organization, we can ensure that our solutions are able to bring equitable access to healthcare for underserved populations across the globe.
My day-to-day job within Thermo Fisher as a general manager of Global Health Equity and emerging markets is kind of twofold. One is to actually build solutions. I actually manage a team of product managers and business development, and to actually build new technologies predominantly in the molecular space that focus on infectious disease and oncology applications. The second component is on a broader level. So I also wear a hat more on the partnership levels in those types of conversations of looking at how do we actually work with funders, with implementing partners to actually hear and understand some of the solutions that they're trying to bring to bear. What is it that Thermo Fisher can actually bring to come alongside to implement and execute on those solutions, and to work with those partners to actually make impact?
I help connect, advance, and shape the relationships that our company has with public policymakers. And public policymakers are governments. They can be nonprofit organizations. They can be large multilateral organizations like the World Health Organization. They could be philanthropic organizations like the Gates Foundation. And those are entities that I work with and communicate with and try to build trusted relationships with on behalf of one Thermo Fisher, on behalf of the company, in order to advance our mission for global health equity, really forming those connections and helping those external audiences especially understand what Thermo Fisher is doing to advance global health equity.
I really enjoy working for GHE from a personal point of view as well. Every day I work with people all around the world, with a huge diverse group of people. And I find that incredibly fulfilling and enjoyable. We work on many challenges, and if we can solve a lot of the challenges in GHE, I think we also solve them for our Thermo Fisher customers and help the business be a much stronger business, both for people in low and middle income country and across the board.